Thank you. So I exit full screen. You got to exit full screen. Cut your microphone off. Your microphone and cut your speaker.
Pam.
Joined the meeting.
Pam.
I can hear you, Miss Lee. Pam, can you hear me? This is Tanisha.
I can hear you, Tanisha, but I can't hear Pam.
Okay, I didn't say anything yet.
Oh, okay. Well, I was just alerting you. I heard from Mr. Fergus last night, who wanted us to know that he's not going to be able to join us this morning because he has a doctor's appointment that conflicts. So
Okay.
I just wanted you to know that.
Thank you. I believe we're waiting on Chairman Huggins.
That's what it looks like to me. Yes.
Yeah, it came up that some people were in teams. So I sent a chat to the team to tell them that we were on the Zoom call.
Click on there.
Okay.
Go to the little bubble.
Or rename.
Yes.
Is that?
Once you find out who, you just type their name in.
So now Jeremy is saying that you started the meeting in Teams.
Yeah, just curious if anyone was still there.
Okay, I see John. Who is the 9339963?
Huggins.
Oh,
I think that's
Join the
Pam.
meeting.
That's since
Thank
I-
you.
Comments from Pam?
I just made you co-host. Okay, Chairman Huggins?
Yes,
Good morning, sir.
good morning. Do we have a quorum?
Yes, sir.
Okay, very good. Good morning, everyone. It's been established that we do have a quorum, and is there a motion to adopt the agenda?
I so move.
Is there a second?
That has to be you, Derek, because Mr. Burgess isn't gonna be with us this morning.
Okay, very good. And I second it. All in favor, aye?
Aye.
Very good. Aye. Next, we have the approval of the minutes from the February 5th meeting. Is there a motion to approve those minutes from the 5th?
I make a motion to approve, and I also want to thank Pam for the amount of detail she's given us, but I hope that's not too much of a burden, because I know we usually do summary minutes, and I know she's trying to capture almost everything that we do. So she's doing a good job, and I make a motion to approve, but I don't want to overburden her with the detail.
Thank you. I second that. All in favor, aye?
Aye.
Aye, very good. Motion approval to the February 12th minutes. Is there a motion to approve?
I so move.
I second. All in favor, aye?
Aye.
Aye, very good. Is there a motion to approve the minutes from March the 12th?
I so move.
And I second. All in favor, aye?
Aye.
Aye, very good. All right, Mr. DeChamps, I'm gonna turn it over to you, sir.
Yes, sir. Thank you, Mr. Chair. First of all, we'll continue on down with the agenda, update of the executive order, South Carolina. Back on March 8th, the governor did issue another executive order for additional 15 days. And since then, I checked also this morning, since we sent out the packet, the governor also issued another executive order on March 23rd of this week for another 15 days. So that's where we are now currently on the executive order. The comment continues to operate under our COVID-19 policy as far as enforcing the requirements of wearing a mask and social distancing, and also as we do our operations out on the streets. We also continue to enforce the mask requirements and order issued by the current administration, and also CDC, where we're continually communicating with our operators on mask requirements, and they are prepared to address whatever issues out there with our ridership. So all of that continue to go forward, and that's based on the governor issuing his executive order. Any questions on the executive order?
Leroy, two things. One is that the city of Columbia continues to have its mask requirement, does it not?
Yes, ma'am. They did extend it, yes.
So that also supports our continuing our mask, our requirements for masking on buses.
Yes, ma'am.
Okay, and the other thing is that then the main limitations are that we're still operating on just the modified routes because of COVID. Is that's the effect of the executive order right now?
Yes, we continue to operate the service level that we are now based on the executive order, as long as the governor keeps issuing that executive order.
Okay, thank you.
We're keeping service levels where they are currently.
Actually, Ms. Moon, may I just add a comment to that, if you don't mind?
Yes.
Yeah. While we are still running the reduced service levels, the board did approve to make that permanent back in September. So We'll be coming back to the service committee in the future if we see significant increases in demand to warrant additional service on some of the routes. I just want to make sure that's clear.
So, well, now I want to be clear too. So we started out with an enhanced Saturday, Sunday routing with the COVID.
That is correct.
And so you're saying that enhanced Saturday, Sunday schedule is permanent until the board takes an action to make it different?
Yeah, because the board took that action back in September when we had the public hearings after reviewing the service.
I understand what you're saying. I'm just suggesting it. Okay.
Okay.
Okay, any other questions or comments on the executive order? If not, Mr. Chair, we'll move right on to B. We have an update of the Comet operations from Ms. Maurice Bell.
All right, good morning. Glad to be here today. Nice, although it's so gloomy a little bit outside, it's a good Friday. Ready to report that our detailing, although we're looking good on our numbers, we finished with 342 detailing vehicles, as well as 400 of the fogging, and the daily cleaning is currently at 1,206. The challenge we've recently noticed on some of our detailing, however, is that we had some challenges with the wash bay that we're currently working on. We're asking for the vendor to come back out and do another assessment based on the line of repairs that have been done in order to improve the results of the vehicles. The current vendor right now is gone through and done another assessment, and I think you guys will start to see a different appearance, especially in the wheel department, based on that assessment that they made and services they've added to it. Food deliveries for the month of February, obviously it stopped on the 19th, but we finished the month of February with 30 during that period. And then on the COVID vaccinations, I know last report I didn't have that, but TCS reported that they had a total of 5 individuals that received vaccinations, where there was 3 of the reservationists, 2 supervisors, and 6 drivers. Right now, our operator numbers only show that supervisors have recently taken advantage of the vaccinations, and operations department is actually trying to get another assessment from operators volunteering that information that they've actually taken the test. So that's what I have in my report for right now. Are there any questions?
Okay, any questions for Mr. Bell? If not, we will move on to the update of testing and vaccination of employees. We continue to work with Lovelace Family Medical to provide COVID-19 testing here at the administrative building. The challenge they're working with now and working with us on is the number of staff that they have for that. So currently, the next testing date that we have here is scheduled for April 23rd. That's a Friday, from 11 a.m. to 3 p.m. They did have to push that back, again, based on the staffing availability, but we continue to offer testing here. We've quite naturally tried to continue to emphasize that the staff here get vaccinated. We have had pushing closely to about half of the administrative staff that has been vaccinated, or at least have had the first shot, and there's some that also have had the Johnson, which is the 1 shot and you're done. So we continue to encourage our staff here to get vaccinated. Also, too, we continue to offer testing down at Comet Central, the kiosk there Wednesday through Saturday. The hours are still the same, so we're still offering that. And that's where we are on testing and vaccination. I think I'm going to leave the next portion to D if there's no questions. where we'll get an update on that.
I do have a question, Mr. Deschamps. I do have
Sure.
a question. Ms. Reed, Mr. Fergus had asked about the possibilities of having vaccination points at the center, the transit center. Is there any more information on that?
Yes, sir. I'll go ahead and give that report. So I reached out to Prisma Health on the next business day after the last meeting, which was Monday, March 15th. I emailed Regina Brown, the Community Relations Manager, and Cassandra Waddell, who's the Supervisor over Chronic Disease Prevention at Prisma Health, who is over the pop-up and the vaccination schedules for Prisma Health. I received an email back from them Wednesday, March 24th at 9:49 p.m. saying that they have discussed the possibility of a pop-up mobile vaccine clinic at Comet Central with the leadership team there, and they will not be able to commit to that at this time. I also had further indication that they were condensing all of their vaccinations only to be at Gamecock Stadium at this present time. And they asked if I would reach out to DHEC because they were under the impression that DHEC had more vaccines. I did reach out to our contacts at DHEC, and they gave me a list of providers who have the vaccine. And so if it pleases this committee, I will reach out to Gerald Israel to help me contact some of those pharmacies like CVS and Walgreens, the people who are over those, to see if they would be interested in having a pop-up site at Comet Central.
Thank you very much. Mr. Deschamps, you can proceed, please.
Mr. Chairman.
Yes.
I'll just add that I just know from some personal contact that some of the individual providers, like Pam they've been suggested that we contact, that they also are under some limitations in terms of the actual number of staff that they have to put the shots in the arms. Because they need, and so I'm aware that those individual providers are trying to recruit volunteers to help. And so I think we really are very much a work in progress in trying to make this more readily accessible, including at the transit center.
Thank you very much.
Okay, we'll move right along to D, update on vaccination and impact to public transit. Ms. Bino Reed and Mr. Handel.
Yeah, we just briefly talked about the vaccination efforts that we are trying to do at Comet Central, and as Ms. Bino Reed mentioned, we'll continue to do that. We are still in phase 1B, and as we've already provided notice to all the Comet employees about the ability to obtain a vaccination, and RATP Dev, as they report, have done the same. We are in discussions with Lyft and Uber to partner with them to access the donations that they've received to transport people to the vaccination as we start to prepare to get to phases 2 and 3. And that will add to the mix of services of providing free transportation for those that would like to get the vaccination. With the resumption of fares that will be coming on April 12th, we'll be working internally on a process for people to demonstrate that they have an appointment so that they can still receive that free access to vaccination transportation on the Comet fixed route buses and DART paratransit service. We'll keep the board apprised on that. One thing I would like to discuss with this committee is I've been participating in the APTA bus operations committee in relation to COVID-19. And there are some transit agencies that are offering an incentive bonus to encourage its employees to receive the vaccination, and would like to see if this committee is interested in us pursuing something like that could potentially be covered by the America Rescue Act funding that we're anticipated to receive to the Columbia urbanized area, which is approximately $9.7 million.
Repeat the question, Mr. Ando. Repeat that question to the.
Would this committee like us to pursue paying an incentive to all employees, whether, for if they're able to get vaccinations?
And are you saying that there is a precedent that other entities are doing the same thing?
There are other transit agencies across the country that are doing that to achieve ultimately a 100% vaccination rate. And they're incentivizing with money.
Ms. Mood, do you have any thoughts on that?
Yeah, I really have a question for Mr. Bell. And Mr. Bell, I'd be interested in what your sense is of whether that would make a big difference or a difference in the number of our employees who would seek to be vaccinated. Do you think an incentive would be a reasonable way, or do you think they're going to want it anyway?
I think right now from early talks, there's a lot of folks that want it anyway, but those that are on the fence are looking at a lot of reasons why they're not. An incentive always helps under these circumstances, and we can probably see an increase of about 20 to 30% wanting to receive it based on the incentive.
Okay. Well, Mr. Chairman, I certainly don't have any objection to our exploring what the details of that would look like.
I don't either. So let's make sure, Mr. Ando, we do proper chain board information and notification to the board to let them know, the full board, let them know what we're doing and what we're thinking. I don't want to operate outside of something that is so can be really something that could help catapult us in a different percentage without notifying the board. So, Mr. Ando, if you would please proceed, but proceed with caution and proceed with information to the full board.
I'll work on that, Mr. Chairman.
Thank you, sir. Good, very good work on that.
And that concludes the vaccination report.
Okay, very good.
I have one more question. I may have missed it somewhere in our data, but are we getting data yet on how many people have actually used our efforts to give free rides to the vaccines? Do we have numbers on that?
We do, as it relates to those using through the DART program. It's a bit difficult to do it from the comment system, but starting April 12th, when we have that mechanism in place, we'll be able to track better on the comment system. Mr. Bell, may I ask if your team can update the committee about vaccination transportation numbers?
Yeah, sure. Matter of fact, Dennis just worked on those numbers. Dennis, go ahead and share that information with the committee.
Yes, currently we have performed 46 trips from Christopher Towers, 22 from Ensor Forest, and we are set up to do another 24 on the 1st of April for Ensor Towers. I'm sorry, for Christopher Towers. So we have about, we performed about 72 so far, and I know Pamela is working with the public and some of these long-term facilities, so we can maybe get another mass group going through.
Good. Thank you very much.
I wanted to be noted to the minutes, Mr. Ando, that I really do appreciate your staff and Ratsdale staff working very hard and being very informative to this committee. This is one of the committees that have shown action, and I do commend you for your work. Ms. Donna Reed, I do commend you for your work. And Mr. Bell, I do commend your staff for their work. So at this time, is there a motion to adjourn?
I so move.
And I second. Have a great Friday, everyone.
Thank
all
you.
in favor, aye.
Thank
Aye.
you.
Thank you.
Good day.
Have a wonderful weekend.